Good morning, and thank you very much for the invitation in this very interesting meeting. The current and even more the future health service organization is influenced by a combination of several interconnected and extensive changes. I am referring inter alia to social changes like aging of the population, migration processes, increasing social request of information about healthcare and assistance. Cultural changes, like diffusion of multicultural and intercultural contexts, different body cultures, transition from healthcare to well-being, and from treatment to prevention. Technological changes, like relatively easy availability of digital technologies, internet of ICT technologies, sensors, tags, new materials. As a consequence, new ways and new opportunities to organize territorial medical services are appearing. Mainly concerned in this process is the hospital that is changing its role. All the most important diagnostic tests, medical imaging, treatment, medical research are now concentrated in the hospital. These require advanced equipments used by experienced technical staff, but also activity like monitoring and prevention that could be made more easily and efficiently at home or in facilities out of the hospital and spread out across the territory. It is possible, for example, to regularly survey and to share physiological parameters to control the accuracy and the results of rehabilitation exercises in real time. We can improve the prevention of sport and occupational diseases and the physical activity to a healthy aging. It will be even feasible to practice comfortably at home at least a part of complex treatments till now possible only in the hospital. In other words, the approachability to health services is dramatically improving for a growing part of the population. Thanks to the use of the so-called emerging technologies, we can design new devices essential to that end. Devices that are very different from the hospital technical equipments and are more related to articles of everyday use. The patients, in the widest meaning of this word, are no longer passive subjects. They now have to learn how to correctly use devices they never knew before, to understand the information they receive, and to differently interact with the medical staff. Design, or more precisely, a combination of product design, communication and information design, services design, etc., can contribute, together with other disciplines, competencies, and skills, to propose new ways to square up to such new conditions, problems, and opportunities. In the Università Io di Venezia, we are working in the education and research fields on these issues, and I'd like to present to you some outcomes of our design experimentation. The color is a smart T-shirt for outdoor physical activity, which simultaneously monitors and combines physiological and environmental data. Thanks to a network of nanosensors built into the fabric and the device placed on the back, the smartphone application records all the physiological, environmental, and route-related data. O2 is an intelligent glove for tracking, able to prevent the health dangers of non-professionals, detecting heartbeat, respiration, air quality, and oxygen rarefaction. In addition, It geolocates the user and, if necessary, sends emergency calls. All environmental, physiological, and route data are recorded into a smartphone application. Clito is smart socks for ankle rehabilitation monitoring that allows to monitor the degree of mobility of the patient's ankle during the phases of recovery from the distortion. Thanks to the real-time programming of the rehabilitation exercises by the physiotherapist, it reduces recovery time and anticipates the return to activity. SWAFE is a monitoring system for training professional swimmers. It consists of a device applicable to the athlete's swimsuit and a smartphone application. The project is designed to meet the need of both coach and athlete, monitoring the athlete's stress levels and thus facilitating the planning of a balanced workout. Mani2 is a home telemedical cardiotopograph designed for high-risk pregnancies. Two wireless devices record the fetal heartbeat and these active movements. The smartphone application sends all the data to the doctor in real time. Link is a kit of devices designed for caregivers of people affected by Alzheimer's diseases. It geolocates the patient, monitors his emotional states and physiological data, and when needed, alerts the caregiver. EVO is a telemedical inhaler for medicine assumption, which monitors their correctness and the regular intake. It's designed for people suffering from chronic atherosclerosis who need to assume several medicines every day. The device synthesizes the active ingredients of each drug during the inhalation to prevent ulcers and injuries of the digestive system. VIRA is a device for early diagnosis of human papillomavirus and prevention of cervical and oropharyngeal cancer. VIRA is rapid and invasive and non-invasive. The inner biosensor makes the diagnosis in real time from a small sample of saliva. Age design is not a didactical project, but is an interregional cooperation project between Italy and Austria, funded by European Commission. UAB, our university, and other 5 partners are developing an integrated system for an active and healthy aging. The project addresses 4 research topics: muscular control, functional ability, vascular circulation, body hydration. Overall, the system put together a smart suite for motion capture to monitor physical activity and the correctness of execution of specific exercises, a device for electrocardiogram and pulse oximetry, a wristband to monitor heartbeats and arrhythmia and body hydration. All the data and feedbacks converge into a smartphone application. Relief is a portable artificial kidney that fits into a backpack. It redesigns shape and functions of the first wearable artificial kidney. All the disposable components are collected into an all-in-one and plug-and-play cartridge. Pumps, sensors, battery, and ultrafiltration scales are inside the device. This last project is the Master in Design by Alessia Buffagni, who is the photograph today, and is now a PhD student in our university. And this project is the outcome of a cooperation with Professor Claudio Ronco and this research group. I'm very grateful for his invaluable support. I hope this experience was of some interest also for him, and that we will have further opportunities to cooperate. Thank you.